good shape. All right, let's get going. Whoops, somebody had wanted to look again at that one. I hope they got it. Okay, now you're going to get tired of me talking about the stop strategy, but please put it in your head and use it. You'll get to where once you use it a little bit, you will understand how important it is and you'll just do it. You won't even think about it anymore. But we're going to use the stop approach for all of our questions, and you need to also. What is the S? It is the story. Succinct, very little. What are you talking about? Identify the issue and the client. The next one, the T, is think. Think about keywords. What identify the stem, like we've been talking, as true, false, or priority. What are your keywords? What options? You have so much knowledge, and you'll read a question and think about the keywords, and you'll think, okay, this could be, this could be, this could be. So, real quick, your brain fills in some things as potential responses, what you think the answers should be. And then it's when you go look at your options and go through them, true, false, through all of those options, and you pick one, make your selection, and do not change it. How many of you have ever changed an answer wrong and made it wrong? Has anybody ever done that? Surely not just me. Yeah. Well, when I was in nursing school, my instructor saw one of them figured out, or in talking, she figured out what I was doing, and she told me, you need some behavior modification. And I said, I'm sorry. And she said, here. She handed me a rubber band. It was about a quarter of an inch wide, nice strong rubber band. She said, put it on your wrist, and she said, now take it, pull it out, and pop it. And I said, that is not the most pleasant thing in the world. And she said, anytime you think about changing um, your answers, pop yourself. And after a little bit of discussion, I thought, okay, let me try this. And do you know what? It worked. Not long after popping myself 3 or 4 times, it got in my head, don't change those answers, because my initial answers were usually the correct ones. Or at least think about it before you change those. Now, I'm not saying you have to get a rubber band and do it. I'm just saying you find some way to stop yourself from doing that, to really think through what you're doing. Is your confidence is down and you're overthinking, and it's going to point to making the wrong choice. Okay. Yeah. Can you tell it's another soapbox, right? Okay, using stop. Now, don't give me answers. Don't give me answers yet. Look at the stem. I want to look at the stem. Just a second. Somebody in the waiting room. Okay, this client is 6 days post-op epi. They come back to the ED after 6 days post-op, right? They with a temperature of 102 degrees Fahrenheit. I'm just going to go with Fahrenheit right now. What should the nurse anticipate doing next? Okay, our STEM. Is it a positive, a negative, or a priority? Tell me. Don't you look at those answers yet. Is this a priority, a true, or a false? Yes, there you go. So that means what? All of the answers could be correct, right? Okay, first off, now we've got that. We know that it's a priority. What is your very succinct issue? It's not the temperature. Absolutely, it is the temperature. I was going to say it's not the appendectomy right now. It's the increase in temperature. That is significant. It's not 100.2, it's 102. So it's a significant temperature, especially 6 days post-op. Okay, now then, think of your keywords, and I already gave them to you. 6 days post-op. That lets you know that in the usual thing of surgery, day 3, you start having an increased risk of infection, right? Um, so you're thinking, what is my best action here? Encourage oral fluids, obtain blood cultures, apply a cooling blanket, and administer acetaminophen. Now, what are you looking at? You're looking at the temperature. Which one of these answers are you going to want? You're not looking at the patient. You're looking at the temperature. There you go. You're getting it. Good deal. Well, we did the stop. Obtain those blood cultures. In real life, all of these are probably going to be bam, bam, bam done. But you want the blood cultures right now because you want to give them find out. It's going to take 24 hours to grow anything, right? So you get those blood cultures before you add this broad spectrum antibiotic, which is probably what you're going to do. And hang on, somebody was in the waiting room. And you want those blood cultures so you know how to treat this patient. Okay, now you've got the blood cultures. You can give them the um, acetaminophen. Well, that's a good question. The least invasive is you kind of adjust that just a little bit because you're looking at the temperature, right? You want to get the very best way to um, uh, get to the cause of this temperature. Um, the others need medical order. Yeah, they do need an order. This kind of question confuses me because I think that I will always need an order. Um, in this question, if it's listed in the options, then as far as the NCLEX goes, now I don't know about your nursing program. Probably they're the same way, but as far as the NCLEX goes, if it says that they are there, then you don't have to worry about an order. Okay, you really don't. The least invasive, yeah. You're dealing with the overall patient. Let's deal with this temp first. Okay, it won't affect blood culture. That's true. Now remember what I said. Most of these things are you're going to do them bam 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 the same. You're going to call lab to get the blood cultures. This this is and you're thinking in a let me think, a clinical way, which is fine. But obtaining those blood cultures is gonna set the stage for the rest of your activities. Okay, if the option is there, yeah. Same for you, yeah. Ms. Denton is saying same for your test. If the option is there, there is an order, so don't worry about that. Um, this is why stop is going to be helpful for you because you look at a very succinct story or an issue, and this is your temperature. A global issue is you want that temperature to come down because this person probably has some sort of flaming infection in that post-op, that appendectomy site, right? So the very best thing you can do is get the blood cultures and then start the other. And somebody said you'll have to have orders for these, but you do have orders for these because they're listed. Okay. Focus on the stop is very succinct. Okay, we're coming to the end of this. We've looked at examples of NCLEX item formats. The first step, identify the client in the issue. Rounding should occur with fill in the blanks at the very end. How many answer options are provided and select all that apply? Remember, how many how many um, options are in the status? Remember what we said? No, not correct. You are correct with that, Leo. But how many options? That's 5 to 7. Yeah, 5 to 7 options. You may have one correct. You may have them all correct. Correct, or you may have any number in there correct. But you're presented with 5 to 7 options. Good. Okay, we're ready to go on. We need to look at some strategic. We've already had a break, so let's go on. Grab that handout again. Hopefully, you have it right there with you. You're going to need to take it with you until you get some of these things more in your head. Use priority setting frameworks. You've got Maslow's hierarchy of need, ABCs. Now, that's not necessarily CPR, that's looking at the airway, the breathing, and the circulation, safety and risk reduction, and nursing process in these strategies, these frameworks. I'm sorry. Maslow's hierarchy of needs, you kind of remember it. It's used a whole bunch. Remember at the very base, the biggest one is the physiological. The patient is not going to be able to get to any of these other levels until the physiological is made, right? Is conquered. So a client reports shortness of breath. That is physiological. The client states, I accepted a new job promotion. Self-esteem. The client attempts to get out of bed. Which one is that? Which level is attempting to get out of bed? Yeah. Thank you. Yes, y'all are good. Security and safety and security. The client states, I enjoy helping others reach their potential. Self-actualization. The client experiences loss of partner. Somebody chat. Which one is that? Loss of partner. Yeah, absolutely. Thank you. Love and belonging. Y'all are so good, so good. Remember that unmet needs in the lower levels, such as physiological, can really impede the ability to fulfill the higher. They can't think about all of this if their pain is so high or things like that. The physiological is not taken care of. Good. Now, Maslow's hierarchy of needs. Excuse me, I have to cough. Pardon me. Um, a nurse plans, don't look at the answers yet. Look at the stem. A nurse plans to assist an older adult with a tub bath. Which action is priority? Use your stop. What is your issue? Your story? Older client, tub bath. Okay. What about your keywords? Yeah, tub bath is a big issue, isn't it? It can be safety. Absolutely. Older adult, tub bath. And what kind of stem is it? True, false, or priority? Priority. Thank you. Yes. Okay. So look at the options. Um, Evaluate the ability to stand alone. Keep the bathroom door unlocked. Observe sacral area for breakdown. Wash extremities from distal to proximal. Good. I was going to put up a poll, but y'all are good. Y'all are answering. And so far, so good. Good. Okay. Evaluate the ability to stand alone. Let's talk about it just a minute. The most immediate risk for this client is injury due to falls. You know that 1 in 3 adults, and remember, adults are 20 to 65 in the NCLEX. Um, Above 65, they have a different designation, and below 20, they have a different designation. But 1 to 3 adults age 65 and older fall each year. Pre-existing medical conditions, medication, limited mobility, all of these things contribute to that. Maybe there's a wet floor or items on the floor. You have a nice kitty cat that loves to love on your ankles and doesn't get out of the way in time. But you, as this nurse that passes it in class the first time, right? You should identify if their functional ability. How are they going to do that? Their musculoskeletal strength and balance before a tub bath is initiated, or you may end up with some problems, right? Weak or unstable, at risk for falls. You see the bracelets, or we do here at hospitals here in Texas, the bracelets fall risk. Usually, almost everybody has a fall risk, so you have to be very careful to still look and evaluate um, their ability to stand alone. So that is your priority. Two is keeping the bathroom unlocked. It is true. Remember, with these priority, all of them can be true, but not not the priority. Keep it unlocked. Yes, it's not a priority for the safety of the client, but it needs to remain unlocked to allow you to get in there in case they have a need, right? Observe the sacral area for breakdown. That is a wonderful thing to do, and you will be doing it as they take this bath, but it's not priority. It is not part of their safety, right? You're going to watch that and do special care to it if you do have a breakdown. Wash extremities from distal to proximal. This is not a priority, not related to the safety, but that is how you should wash um, your your client. Okay, get the idea of priority here. Ah. Then Maslow's safety. Okay, we're still on Maslow's hierarchy of needs. This client, remember, don't look at the answers yet, look at the stem. A client wears a prosthesis on the lower leg. The nurse should recognize which statement that indicates acceptance of the change in body image. This is a difficult question. Any time that they ask about acceptance of change in body image, you have to focus closely on that one. What is your stop? I mean, your story. What is your issue? Lower leg prosthesis? Yeah. Your keywords: statement, acceptance, body image. This is not a priority. Is it a true or a false? It's a true. Yeah, it is a true. Um, okay, y'all, now look at the answers a little bit. What is that question asking? A statement indicating acceptance of the change in body image. Think through acceptance. Okay? All right. One is the proper answer. It's important for a client who has a loss of a limb to find pleasurable activities. They can use adaptive devices um, that allow full participation in active sports like basketball and hiking and skiing. Um, this client's statement reflects acceptance of the change in body image and lifestyle modifications they're going. They're they're uh, they're going to do this. It does. I mean, they've accepted the change. That's not a big thing in their consideration anymore. Okay. Last week was the first time I put on makeup. Yeah, it doesn't have anything to do with the limb, does it? They are kind of verbalizing feelings related to their change. Yeah, to the change in the body image, and this is maybe therapeutic, but they need to. They're not yet there yet. Um, uh, since my surgery, everyone seems to treat me differently. That's kind of a whine, don't you think? That's kind of a they have not accepted. They need some help discussing these changes and some therapeutic communication to bring them on. This is more a low self-esteem type thing. It's difficult to think about not being able to drive anymore. Well, see, that's just wrong because there's occupational therapy and assistive devices that help people drive quite a lot, with more wrong with them than one missing leg. Okay? You see what you're needing to look at. They're ready to go on with life without worrying about that. It's almost like they still had the leg, so they have accepted this change. It's in self esteem. Now, second priority setting framework is the ABCs. Uh, you've had CPR. You know that the airway has to be open or patent. That's your first thing when you look at a patient, is the airway open or patent? That is your first consideration when you look at a client, because without the ability to bring in oxygen, they can't survive. So you're looking at asthma, foreign body obstruction. This all closes down the airway, the trachea, etc. The airway closes it down. Then the breathing. No, these are not. These are uh, priority setting framework. Okay, not default. Thanks for asking. Um, Breathing is the mechanical event of in and out of respirations. It really, that's what breathing is. Is this mechanical event effective? They may have this little bitty respiratory effort that's coming, from their medulla oblongata, but it is not stimulating the the body to breathe. Um, this is second. If they have an open airway, but their chest is crushed. They cannot inhale and exhale. They will not survive. Circulation, then, after you look at their airway and their breathing, look at their circulation. They can bring oxygen into the body. The thorax can move so that they can breathe. You need to then assess if there is something in the way of the body's ability to transport this. Some of the things are peripheral vascular disease that get in the way, or myocardial infarction is one, right? Okay. Now, a nurse cares for a client who has crackles, dyspnea, and hemoptysis. Which intervention should be implemented first? Give me what kind of stem. What kind of stem do we have? I'll give you the answers in a minute, or the options. What kind of stem? Priority. There you go. Thank you. Now then, what about your keywords? You have several. Client, crackles, dyspnea, hemoptysis. There you go. You're getting them. And first, and your stem type is priority. Okay, you think about, in your mind, you don't have to chat this one, but they have these things. Which intervention are you going to think about first? Let me give you the answers. Are you going to, which intervention? Obtain a sputum culture, infuse electrolytic ringers IV, administer albuterol via aerosol, or review the lab results for CBC. Remember, priority, they can all be right? So, which intervention are you going to do? Absolutely. Oh, y'all are good. Ha! Told you you'd pass on the first NCLEX. Yes, because you're dealing with this airway. Now, students sometimes get uh, um, looking at dyspnea, they think breathing, but this is airway because of the dyspnea, and they're coughing up blood, right? So administer that albuterol. Are you going to look at that lab results for CBC? Oh yeah. Oh yeah. It doesn't fix crackles or hemoptysis, but the dyspnea is the one thing that it will, and that is what is related to your airway. Um, what was I going to say? Oh, yes, I'm going to go look at that CBC. What is there? A lot of it, but especially the WBC and several things that are going to let me know what's going on with this patient. And then infuse lactated ringers. It's a good chance if they have some type of pneumonia. It's a good chance they'll get that, and you will probably obtain sputum culture, but that's not your priority. Okay, this is two questions, and they want you to look at the difference in words that make a difference. This nurse cares for a client who has bacterial pneumonia. Initial assessment findings include a heart rate of 128, respiratory rate of 32, and an SpO2 of 89%. Which intervention should be implemented first? Okay, once again, we have a first, so that is priority. That means that all of the answers may be correct, right? Right. Now, what else do you realize with this client? SpO2 is low. Tachycardic? Um, tachypnea. This patient has some problems with hypoxia, don't you think? Yes. So intervention to do first: obtain a BP, offer oral fluids, infuse normal saline IV, administer 2 at 4 liters. Yeah, y'all pick that one up because of that SpO2. That is what you're wanting. I mean, that's what your priority is. A breathing problem. Immediate action should be to administer oxygen. Okay. Now then, this one. A nurse cares for a client who has bacterial pneumonia. Assessment findings include a heart rate of 140, the tachycardic, right? Respiration 2024, sort of tachycardic. Hematocrit of 55. Which intervention should be implemented first? What is your stop? Do a little bit of stop there. We have a priority again. Um, you have tachycardia, mild tachypnea, increased hematocrit. We don't have anything related to the oxygen level, so we're not going to worry about the oxygen level, right? Okay. Administers ceftriaxone, antibiotic, or oral fluids, infuse normal saline, administer oxygen. Which one do you think is going to be your, what are we looking? Correct. Based on that hematocrit, that is increased. That is a sign of dehydration. Dehydration, right? So um, you're going to, and you got two things related to dehydration: offer oral fluids, offer or infuse normal saline IV. You have an increased hematocrit, which indicates a little bit of time, so you need to get fluids into this patient quickly, don't you? Bacterial pneumonia, so it's going to be the rapid way of getting this fluid balance back, hopefully. Rehydration, fluid volume replacement, that's the quickest way to do it. The minimum fluid intake for a client who is not fluid deficit should be 2 to 3 liters in 24 hours. Okay, you'll be learning more about that. But the signs and symptoms of fluid volume deficit, tachycardia, hemoconcentration, etc. Good. Y'all are good. Now then, some client safety issues, risk safety and risk reduction, some client and environmental safety issues. Client ID. What should be done to reduce those risks? Apply armbands. Uh, there are others, but these are just one that popped out. Client safety. Place a security alarm on the infant. Procedure related to accidents. Be familiar with standards of practice. Anytime I take a group of students to clinicals, we look at where the unit's policy and procedures are. Usually they're on the computer now, but you look at. I have them look them up so they know, as a nurse, that is what they're going to to be held to and where they are. So be familiar with standards of practice and what you're doing. Fall precautions. Implement fall precaution program. Answer lights promptly so that the person doesn't think they have to get up and go to the bathroom when really they shouldn't get up. One other student suggested bed alarms. All of these are good. Least restrictive appropriate devices for ambulation and transfer. All of those uh, things for fall prevention. Equipment, inspect equipment for potential hazards. Both as a nurse and especially as a respiratory working in the ED or the ICU, every time I came on duty, I would check equipment, make sure the ventilators were working, check that uh, the ambu bags had proper equipment, and multiple times I've gotten into a code and figured out that somebody cannibalized the oxygen flow meter, and so there was a delay getting an oxygen flow meter in there I could hook the bag to. So after you go through that one or two times, you want to make very, very sure that you inspect the equipment ahead of time for potential hazards. You don't want to leave it to chance. And then disaster, most institutions have their own thing with the RACE protocol. It's a lot of times with fires: rescue, alarm, contain, and extinguish. When you go into get a job in an institution, they will orient you to all of this information. But safety and risk reduction. A nurse reviews the medical record of a client scheduled for a liver biopsy. Which lab results should be the priority? Now, don't answer yet. Um, what is your stop? Liver biopsy. Okay, think a little about the liver. Is it uh, pretty, has a lot of vessels? Yeah, blood vessels. What about your key thoughts? Lab results, and it is a priority too, right? So they can all be correct. Um, think about the answers then. Which lab results is going to be a priority before you go in and grab a bite of this liver and take it out for a biopsy? Yes, absolutely. Good job. Platelet count of 40. The hematocrit, they'll need to have a hematocrit because a hematocrit is going to point them toward a possible anemia. It is low, but a major risk with a liver biopsy is hemorrhage because it's so filled with blood vessels, etc., with blood, and so that's not your priority. Number two, WBC's of 4,000. Actually, that's kind of low. Your normal is 5,000 to 2,000, right? But it may be low, but that's not your biggest priority with grabbing a bite of the liver. Okay. Number three, an elevated ammonia. That's probably why they're having a liver biopsy in the first place, because that's usually associated with liver disease. Okay, so that is somewhat expected when you see a liver biopsy. Then four is correct because what is the normal range for platelets? 150,000 to 400,000. This person, if they don't be careful, is going to have a big problem with bleeding. Correct? Good. Now, the nursing process: assess, make your diagnoses, make your plan, implement that plan, and evaluate. Nurse auscultates breath sounds, and which sounds are expected. Just your usual bronchovesical sounds, vesicular sounds. I'm sorry, and in the assessment, then the diagnosis, whatever this school nurse recognizes. Frequent wheezing and dyspnea when running, which diagnosis is going to be anticipated, and some pulmonary function testing there. Making a plan. The nurse auscultates wheezes for a client who has asthma. We got a lot of squeaking in there. Which medication should the nurse plan to administer? We're back to that albuterol, right? This implementation, then they have asthma, SpO2 of 89%. You're going to perform which action first? You're going to give them that bronchodilator. Now, it has been administered. Which outcome indicates the therapy was effective? Somebody chat. What outcome indicates the therapy was effective in this client that has asthma? You got it? Increase in the SpO2, yes. Um, and a decrease in maybe the squeaky old breath sounds, right? No more wheezing and increase. Yes. Good. Thank you. Nursing process: a client is grimacing and crying following a surgical procedure. Which action should be the nurse's initial intervention? What kind of stem do we have? Stem is uh, Priority. Yes. It's a priority one. A surgical procedure is your initial thing with grimacing and crying. Okay, think about some of the options you're gonna look at. Um, uh, Reevaluate in an hour. Are you gonna walk out of there with that patient crying and grimacing? I don't think so. Administer meperidine. Well, you've got an order for it, so you could do that, but that may not be your initial, right? Obtain the blood pressure. Yeah, you're going to do that. Ask them to rate pain on the scale of 0 to 10. Y'all know that because most of the, um, yeah, see if he can take it. Check the BP. Um, most let's see, what was I going to say? Oh, most of the doctor's orders for meperidine are going to say give this much at this level of pain on the scale. If it's higher, they will get more or they will get a different medication. So you're going to check them first because this is objective data. The client's self-report of pain is considered the most um, reliable indicator of pain. It's individualized, and this standardized pain rating scale should be used. And you get tired of asking, patients get tired of answering, but that is the best way um, to try to keep their pain as it needs to be on a good level. That's your assessment. Now, priority frameworks. You can write these down, and they will be in the heading as we continue to go through. But get your handout. And least restrictive invasive, we've talked a little about that. And survival potential, acute before chronic. Somebody with COPD, which is chronic, can have an acute thing that needs to be dealt with first, right? Stable versus unstable clients. So, um, somebody is writing lines all over my stuff. I'll get rid of them in a minute. Okay, least restrictive, invasive. Client reports difficulty breathing. Difficulty breathing, least restrictive, invasive, top or bottom? Yes, there are marks all over my screen. I'll get it at break. One screen, go back one screen. I will in just a second. Yeah. The top one, get that head of the bed up right before you have to put the oxygen on. And you may not have to put on the oxygen. All right, is that one? That's the one you want? Did you get it? Okay, remember, these will be in the headings also. So if you miss one, you'll get it. Good deal. Okay, the next one, a pulse oximeter versus arterial blood gas. Has anybody had an arterial blood gas? Yes, do the top one before you do an arterial blood gas. Arterial blood gas I had one done and it was good. I've done hundreds of them, and some go nicely, some do not. You do not want to do that unless you have to. Okay, this one, we're coming up to a break. We've got a few minutes. Least restrictive. A client is voiding small, frequent amounts of urine 6 hours after removal of an indwelling urinary catheter, which should be the initial action by the nurse. All right, use stop. The issue. Client 6 hours after removing indwelling catheter. You may not know just a whole bunch about um, uh, indwelling catheters, but you can answer this question. Your words, small, infrequent voids, initial action. It is a priority and the test taking strategy least invasive. Okay. Um, Picked out, increase those IV fluids. Oh my. If they're already having trouble, I'm not sure I would do that. Perform a bladder scan, assist to the bathroom, administer antispasmodic medications. Yeah, perform that bladder scan. That is non-invasive intervention, and it is going to provide objective data about how much urine is in there. If there's no urine in there, getting up to go to the bathroom is only going to tire them out, right? So do that first. Make sure there is urine there. Then assist them to the bathroom. And as antispasmodic medication may be um, upcoming if they're spasming there and not letting that urine out. But you don't know for sure that the kidneys are producing. So you've got to do the bladder scan first. Survival potential. This is used to prioritize care when the number of casualties or the conditions at the site are overwhelming, and the ability and the resources to treat everyone. This is tough stuff, and hopefully you won't ever have to do this, but this is a framework to guide questions you might be asked or your action once you get into practice. Minor, green, treatment can be delayed over 2 hours. It's threatening. This could be a shoulder dislocation, something that's got to be dealt with, but it's not life threatening. Delayed treatment within 30 minutes to 2 hours. Um, they need to be treated, but not just yet. Maybe there's a large laceration on their arm with oozing blood. Okay, then the red, immediate, treat very right now. You may have a first responder at a fire who has soot and ash looking around the nose and mouth. You know that they have inhaled smoke, and before very long, there's going to be fast swelling in that airway and obstruct. So they need to be treated now. The hard part comes with the black ones. They are expected to die, um, severely injured, but would not survive no matter what care is provided. Sometimes in hospitals we try on these anyway, but if they are asystole already, then probably they're not going to survive. Okay. A nurse reports to the community center following a tornado and assigns a triage tag to each client. Move each box to the right in the selected order of priority. Um, Open fractured wrist, superficial lacerations to the scalp, a crushed pelvis, or asystole. So you stop, you've got clients with injuries, it's priority, and you're going to triage, right, with survival potential. Which one is going to go first? Uh-huh. Yep. Good. Good. Y'all are good. Um, the crushed pelvis, that is a huge area. There are a lot of um, arteries, and stuff in this pelvis. They need transport out for immediate evaluation and treatment. High risk of internal bleeding, which could take them on into shock pretty quickly. Second priority is open fractured wrist. That's going to hurt. It's at risk for infection. It hopefully it has a distal pulse, and but based on prioritizing guidelines, it can be delayed without immediate threat to life. Then green, superficial laceration to the scalp. You know they bleed like crazy, um, but there's a break in the primary defenses, etc. But there's no immediate threat to life. Then the fourth priority. Uh, this is assigned to a client who's expected and allowed to die. In disaster situations, we don't like it, but the guidelines for triage require medical personnel to provide care for clients who have survival potential. The focus must be on the needs of the greater good for the population. Okay, acute before chronic. And um, aspiration, peritonitis, and diarrhea. Those are all acutes. Obstructive pulmonary disease. They are at risk for aspiration, but that's going to be treated before their COPD. Peritonitis, end stage renal disease, a lot of times they will have it. This acute ahead of their chronic, and then diarrhea with inflammatory bowel disease. Okay. All right, we're up for a break. Um, we'll be back at, let's see, it's almost 10 here, so we'll be back at 11 your time. Okay. I'm going to mute, but ask a question.